Coming up next on WVOX, licensed insurance agent and Medicare specialist Mark Brownstein hosts his monthly educational segment, Medicare Mark on the Air. Tune in for guidance, special guest interviews, and valuable information on all things Medicare.
Good afternoon, WVOX listeners. This is Mark Brownstein from Emerald Medicare here again. Second Monday of the month at 12:30. Happy to have you listening to my show again today. I have a very special guest, Colin Sandler, with me. We are here to talk about Medicaid and the work that she does for so many people. Mark Brownstein from Emerald Medicare, servicing Westchester, Rockland, Bergen County, New Jersey, Fairfield County, Connecticut, on all things Medicare. But today it's Medicaid. Colin, welcome.
Thank you. How are you?
I am good, thank you. It's nice to have you on the air with me. And we recently were together supporting the Alzheimer's Association at the panel for the Meaning of the Minds.
Yes.
That was really quite a wonderful panel. We also had a long-term care specialist with us, so that was a lot of fun, wasn't it?
It was. It really was. It was great to give all that education to all the people that were there who desperately need that.
You know, there's about 250 people there, and I think in years past they had 350 or more, but it was a good turnout, and certainly that area of need is certainly important. But what you provide for Medicaid is so important. But before we get into the work that you do, I just wanted to get a sense and share with the listeners just a little bit about, where you live, where your office is, and sort of how you got to this particular part of your career.
Okay. Well, I actually live in Garrison, New York, which is in Putnam County, like literally right over the Westchester line. But I grew up in Westchester, and my business is Medicaid Solutions, which is in Cortland Manor, which is not far from my home, which is lovely. And I've been in business as Medicaid Solutions for about 12 years, working to help families navigate the Medicaid system for long-term care, both at home or in a nursing home. So my job is to educate people and help them strategize how to get through the system. And it's a lot of information.
So you started in social work.
I started in social work, yes.
And then you really sort of saw the aging population as something that really had a great need. And what were the things that you were doing in social work that sort of brought you over to this path?
Well, I started out working in a nursing home. That was really my first job. And I started out right out of college, even before I went to social work school, and then realized that getting that degree would be helpful. And so I took a couple of years off, did my degree, and went back to work in a nursing home setting, doing social work, admissions, and eventually sort of started adding on a little extra work on the side, doing home care and working for visiting nurse agencies, doing home visits as a social worker. And out of that sort of grew my business, because there was clearly a need that people needed more information, more education than a social worker can really give in the allotted time that Medicare provides for home visits. So that's really where the business grew out of.
So I guess it was 2014 or so, you decided to leave sort of the focus that you had on home health visits, and that's when you really sort of flipped the switch over to and grow your Medicaid consulting business.
Yes, absolutely. I was sort of straddling both, doing this business and continuing to do the home visits for the agencies. And I just started becoming busier and busier and said, I'm going to take a leap of faith and I'm going to stop doing the home visits and focus solely on the business. And it just really took off from there.
So much of the work that you do is really in helping people prepare for Medicaid. So tell our listeners just a little bit about your process as you sort of began to and continue to support so many people on a regular basis on a very complicated area. And I just want to sort of mention that so often people think Medicaid, Medicare, they're the same, they're different. And so you probably get the same thing. And So for Medicaid, specifically, what is it and what kind of patients, clients do you support?
So Medicaid is really a poverty-based health insurance program. So it really wasn't meant to take care of people on Medicare. It wasn't really meant for the senior population. It was meant for your average, low-income person who couldn't afford health insurance and who are really poverty-based. But what's happened and what's been happening for many, many, many years is that many seniors who have chronic illnesses and need a lot of care, whether it's care in their home or in a nursing home, can't afford the level of care that they need. So they're sort of pushed into this system. And that's really what the challenge is they're being pushed into a system that wasn't really created for them. It wasn't meant for your average middle-class person. But when your average middle-class person has to start paying $10,000, $12,000, $15,000 a month for care, they really can't afford to do that. So then they're forced into this poverty-based program, and it may not be a perfect fit. And 9 times out of 10, it is not a perfect fit. They have a little bit too much money. They have a little bit too much income. And so there's strategies in trying to qualify for Medicaid to help people sort of navigate those pieces that weren't really set out for them in the first place, and understanding how to sort of manipulate and strategize their situation to make them fit into this program. And it's life-saving for so many people who might either not get the care at all, or might wind up in a nursing home when they can be cared for at home, or might exhaust every penny they have going into a nursing home. There are ways to position yourself to shelter or protect something, even if it's not everything, to help these people get through the process.
So it sounds more complicated than I ever imagined, and I know a little bit, and I always like to have a resource as expert as you. But what is the process for qualification? How do you sort of assess the qualifications and have the conversations with people to determine if you can help them through this maze?
So it is a little bit different when we're talking about nursing home Medicaid versus home care Medicaid. And most people do want to try and stay at home. That's the goal for, most people. Not everyone, but most. And the home care Medicaid currently, as the rules stand, do allow you to move assets around and still qualify for Medicaid without having any penalty, which essentially means I could have, $75,000 in my bank account today, move it to my spouse, to my child, to my grandchild, and qualify for Medicaid the following month. And so that's how community-based Medicaid has been forever, for as long as I've been around and doing this, which is 25-plus years. You could transfer your assets and qualify. So that's been part of the strategy, is what do we need to do to shelter your assets so you can get this benefit? And for most people, it's not sheltering the money so that we can enrich their children. It's sheltering the money so that the spouse that's remaining has assets for their life, or to ensure that they will have enough money to sort of help along with the cost if Medicaid doesn't pay for all the care that they need, so they have some choice as to where they want to be. But there are definitive lines in the sand as far as assets and income that you can qualify. So for assets for community Medicaid, we can shelter by moving money at this time. That's slated to change in October, and they're going to have a look-back period for community Medicaid, which means they are going to penalize people for giving away money, just like they do for nursing home, but it will be a shorter time frame. But in both instances, there's still some ability to protect some assets. And again, my main goal for protecting assets for my clients is because Medicaid often doesn't give you 100% of the care you need in the community, in your home. So having some money to offset what you're not getting from Medicaid is the difference between being able to stay at home and going to a nursing home. So we sit down and we go over people's income, their assets, and we try to work with them to figure out what's the best strategy forward to qualify for that kind of Medicaid.
So you have a weekly educational opportunity for people, and once they sort of reach out to you, then you sit with them. Can you explain sort of your process for people
Absolutely.
who may be interested?
Absolutely. So we do a consultation, which is usually in the office or via Zoom. And in that consultation, we sit down and we look at their assets, we look at their income to see where they fit into this puzzle. And if they don't fit perfectly upon meeting what we can do to strategize, to switch things around so that they can qualify. In addition, we help them to understand what the process is to get Medicaid home care services, if in fact we're doing home care, because that is also, unfortunately, very complicated and confusing. New York State has not made it an easy, consumer-friendly process. So without the right information, people are sort of, poised for failure because they don't have the right information to understand what they're doing to assess. How do you get assessments? Just a whole slew of information that's so critical. So all of that is something that I go over in my initial consultation with the client. And at that point, they then have to decide, is this something they think now that they've been educated that they can pursue independently of me? And if they do, that's fine. Or sometimes clients want me to, shepherd them through the process and take them from, that meeting through application and home care assessments and all that stuff. And we can do both. If somebody's looking at nursing home placement, the strategies are often a little bit different because we don't have the home care component, but there's still a lot of information that people do not get from the nursing home finance people that could be really super helpful to them in maybe protecting something. So it's always important for anyone to think about talking to somebody who specializes in Medicaid, whether it's somebody like me or an elder law attorney, before they jump into that pool, because they are likely to come out, behind the eight ball without some information, because, again, it's not as easy and simple as a government program should be in theory.
It seems to me that people who have tried to navigate it on their own get very frustrated, and the process is long, and you have to dot your I's and cross your T's pretty extensively in order to keep the process moving.
Oh, 100%. And, what happens very often is people say, oh, well, I don't want to hire somebody to help me because I shouldn't, because it's a government program, I should be able to navigate. But the time that they lose in care that they have to pay for out of pocket, in not getting the level of care they need once they're approved because they don't understand the system, is often significant. So, even a simple, straightforward application where they're already eligible may not be as straightforward as you think. So it's always good to talk to somebody. Sometimes people don't need all the help of being taken through the process, but they should be educated. And I think that's probably the most important thing that we do here, obviously aside from helping them get through the program and trying to maximize the services that they're going to get once they're back in the community, but also just understanding what they're up against, what the system looks like, what the time frames are. I think those are really important things for people to understand. And very often when you just sort of jump in on your own, you're not getting that information.
So WVOX listeners, I have Colin Sandler on the radio with me today. Colin Sandler is a Medicaid expert. She helps so many people and has explain, Colin, the weekly webinar that you do, that you offer to people to really get to meet you, but also to become somewhat educated.
Absolutely. So I do have on Wednesday evenings at 5:30 p.m., almost every Wednesday. If there's no date, it means for some reason that Wednesday I'm out. But it's I switch back and forth weekly between nursing home Medicaid and community Medicaid, which is for home care. So I try to focus on one piece of the puzzle at a time. And the webinars are basically the same week to week. Obviously, each one of the two is different. My website, MedicaidSolutions.com, is where you go to sign up. There's a little icon on the right-hand side, a block that says Medicare Seminars, and you click on that, and it gives you the available dates and times. And it's free, and it's interactive, and it's live. In other words, I take questions and answers at the end. And it's just a good opportunity for people, yes, to get to know me, to get to see who I am and how I function, but also to get an understanding of the process without having to make any financial commitment to the process. So I think it's a great service.
It's a great service. I do webinars often, but not that often, and so I give you a lot of credit for being available that regularly. What's your phone number there?
It's 914-924-2566.
Great. So, you have plenty of, I call them allied professionals, but people in the field who know you, know the work that you do. What are some of the professionals that do refer business to you and ask for your assistance with their clients?
Well, you're certainly one of them, and I refer a lot of clients to you because when they come to me and say, I'm having difficulty with my Medicare plan, and what should I do next? I say, well, I'm a Medicaid specialist. You need a Medicare specialist. So I work a lot with Medicare specialists. I work a lot with elder law attorneys and estate attorneys. So there's a lot of attorneys who are not really focused on the Medicaid piece, but have just done your estate planning. So I do a lot of work with them. And I get a lot of referrals from home care agencies. But most of my referrals come from previous clients. I mean, that is the bulk of how people find me is you helped, somebody says, oh, you're in the same position I was in with my mother last year, and you need to call this person. But I do work with a lot of professionals, and part of why is because I refer to a lot of them in the process of making a plan of care for these people. So you may need a day program or a better Medicare prescription plan, or you may need medical transportation or a home care agency or a day program. So I try to really be knowledgeable about as many resources out there because anything we can do to help somebody maintain their independence in the community is going to be a benefit to them.
From talking to you in preparation for this, it seems like you have a real you have your pulse on a lot of the activity that's going on in the community because you're doing your piece and supporting clients, and then there are so many other pieces that still need to be handled. For instance, you are helping them once they sort of have a second meeting. You're helping them with the entire project. Talk a little bit about sort of what are some of the additional components besides just the Medicaid application that you are actually outsourcing or referring other professionals for their assistance.
So when you file for Medicaid, one of the very common things we need to do is something called a pooled income trust. And that is something to protect people's income. That is one of the biggest myths people come to me with is my mom can't qualify for Medicaid because her income is above the limit. And that really is not necessarily a deterrent. There is something called a pooled trust, which allows you to shelter your income that is above the Medicaid limit. So I work with various pooled trust companies to get people into that program to help them shelter their income. I work with a lot of elder law attorneys who will do trusts or wills or power of attorneys for the clients because they need those things as part of the process. I do a lot of work with home care agencies who are then looking to staff the cases for me. Managed long-term care plans are one of the main ways that people get home care services. So I do a lot of referral work to them as well because they're the ones that are actually going to provide the care once the Medicaid is approved. So there is a lot of communication with a lot of other agencies, but really what I do once I'm doing a home care Medicaid application is I work with the client, I tell them what kind of documents we need to get the application filed. If they're hiring me, we gather those documents, we file, we get their pooled trust on board. We then make the appropriate referrals to the state to do evaluations because that's how home care is evaluated, and then out to a managed care company, which will then oversee their care and provide their services. So it is sort of, a multi-step process to get from where you walk in the door to you actually have the benefits that you're looking for and the services that you need.
I don't think that people truly appreciate how many steps there are, but maybe focus just a moment on helping people get prepared for the evaluation from New York State and how really important that is, and then what the services are that the state provides.
Yeah, it's an enormously important process because the state has certain requirements in order for you to even qualify to receive home care. And you really need assistance with a minimum of 2 activities of daily living, unless you have dementia, and then it's one activity. But it has to be a fairly significant amount of help. So I have clients who will do their state evaluation and say, well, my mother's mobile, she can get around, but she's very forgetful and she won't eat and she won't take her medicines, she won't shower unless somebody reminds her. If you present your case to the state like that, they're going to deny you and say you don't meet the criteria because they aren't required to provide safety and supervision. And that description of somebody just needs to remind my mom, prompt her, encourage her, is safety and supervision. So you really need to have some physical need for assistance with dressing or bathing or toileting or walking or transferring, which means getting up and sitting down from any kind of a chair or a bed. You have to have significant amount of assistance needed with at least two of those activities of daily living. They're not meant to come in and do housekeeping and laundry only. So those are huge missteps that people take, and knowing how to present the needs to truly show the state what your care needs are is going to allow you to qualify and then hopefully get some amount of care that you need. But you lose a lot in that safety and supervision concept. Almost any activity, they can push some of the time into that space of safety and supervision, and they don't have to cover that. So that's a big issue for a lot of clients, and that's why a lot of people don't get the level of care that they need. Somebody who has dementia who's mobile is not going to get 24-hour care. They'll be lucky to get 3 or 4 hours a day simply because they're mobile.
So the range, once someone is getting the evaluation, the range of hours are that dramatic?
Yeah, I mean, you could be offered, 4 hours twice a week, or you could be offered 24 hours 7 days a week, depending on the level of care. Obviously, you have to be really physically impaired to get a high level of care, and it's very difficult to get these days. They've really made it very, very difficult to get, which is unfortunate because I still think it's more financially advantageous to Medicaid and to the state to pay for people to be at home versus in a nursing home. But the way they have sort of placed their values on your abilities to function puts a lot of people in a position where they're not going to give them that care to keep them at home.
So two other quick questions. One is, in terms of, can family members actually be a part of the support services that are provided, approved by Medicaid? And if you can sort of discuss some of the other myths.
Yeah. Absolutely. So that is actually a really important program. It's called Consumer Directed Personal Assistance Program, and we in the field refer to it as CDPAP, which is simply just the initials. But that program allows you to hire anyone of your choosing as your caregiver. However, it cannot be your spouse, and it cannot be somebody acting as your power of attorney. So, if your daughter is your primary power of attorney, then she can't sign up to be the caregiver. But anyone else can that's over 18 and legal to work in the U.S. So it gives people a lot of control sometimes of who's coming in and out of their home, or sort of slowly stepping into this space with a family member providing care instead of a stranger, especially if somebody's demented and early stages and is uncomfortable with strangers in their home. So that's a wonderful program, has its pitfalls. One of the pitfalls certainly is the rate of pay is very low. Mostly all home care services in New York State are fairly close to minimum wage. That is supposed to go up by $2 an hour starting in the fall with the new New York State budget. So if it's $13.25 an hour in the northern counties, it's going to be $15 an hour. In Westchester, Long Island, and the city, it's going to go up to a minimum of $17 an hour. But that's pretty low, for a tough job. So it's hard to find people who work for that kind of money other than family members. But it's a great option. Some of the other myths about Medicaid home care is that you can't own your home and qualify. You can own a home and qualify as long as it's the home that you live in. Your income is not necessarily over the limit if you can use a pooled trust to shelter it. That's a huge other myth. One of the biggest things I find that is problematic is family members saying, well, when we apply for Medicaid, I'm sure my mom's going to get 24-hour care because, anyone who looks at her would see she needs 24-hour care. And that, to me, is a huge red flag that family is going to be disappointed because it's really quite difficult to get that level of care, and what they think makes them qualify is not necessarily what will make them qualify. So it's always sort of like, oh, wait, take a step back because you might not get what you're looking for.
What a incredible source of information, Colin. Again, your website, your phone number, how to get a hold of you as we start to wrap up.
Absolutely. So, again, my name is Colin Sandler, and I am a social worker, and my company is Medicaid Solutions. My website is MedicaidSolutions.com. I'm located in Cortlandt Manor, New York, but I can serve anywhere in New York State. And my phone number is 914-924-2566. People can call or even can text that number if it's more convenient. And definitely look at my website for the webinars, because that's a great way, like I said, to meet me and get a sense of what Medicaid specifically, in much more detail than we obviously talked about today, what it looks like for people, and without actually having to commit to anything from me.
Colin, you are a tremendous resource. I am so honored to know you, and as part of my community of people that support, obviously not just seniors, but people who are looking at Medicaid. This is Mark Brownstein from Emerald Medicare. I help people with Medicare, that particular niche, the niche that for seniors turning 65 or retiring after 65 is the work that we do. We love what we do, as does Colin. Colin, one last comment for the people on the air on what to do for Medicaid applications.
Well, I just want to thank you, Mark, for having me. It's wonderful. And check out my webinars. That's where you're going to learn so much information. It'd be great for people to do that.
Thank you, Colin. Be well. And again, thank you for sharing the show with me.
Absolutely my pleasure, Mark. You have a great day.
Bye now.